Okay, I'm going to try to explain umbilical artery Dopplers, which are done typically in fetuses with fetal growth restriction. I'm going to try to explain as quickly as I can and concisely as I can what that means. When you have a fetus with growth restriction, which is typically defined as the abdominal circumference and or the estimated fetal weight at less than 10th percentile, your provider will recommend weekly umbilical artery Dopplers. And that is done to assess the blood flow in the circuit going from the placenta to the fetus through the umbilical cord, and then back through the umbilical cord to the fetus in that nice little circuit there, with the pregnant individual, of course, supplying all the nutrients and blood flow to the placenta. With fetal growth restriction, especially in the presence of a hypertensive disorder or pregnancy like preeclampsia, the resistance in the placenta, because it's composed of numerous small vessels, can increase, causing that blood flow back and forth between the placenta and the fetus to become impaired. Okay, when we do umbilical artery Dopplers, we look for loops of umbilical cord on the ultrasound, and we do what's called Doppler studies. Once we find a loop of cord, that is going to represent the heartbeat of the fetus through the umbilical cord. And the D is the end-diastolic flow. And this represents the relaxation phase of the fetal heartbeat and any continuing blood flow forward through the umbilical artery. This top diagram here where it says normal represents a normal umbilical artery Doppler study with a normal systolic peak and a normal end-diastolic flow. As there starts to become impairment of blood flow from the placenta to the fetus through the umbilical cord and back, the first thing you'll see is elevated Dopplers, where you're going to have an increased measurement, and I won't go into all the physiology and physics behind that, but it's called elevated umbilical artery Dopplers, where the SD ratio is elevated. Then as it progresses over time, you can get absent end-diastolic flow, which represents worsening Doppler flow studies and worsening blood flow through the placenta. And then the most severe form, or abnormal, if you will, Doppler studies would be those with reversed end-diastolic flow, which is the third line here. Now, if the fetus is growth restricted, it's all going to depend on why the fetus is growth restricted, how growth restricted it is, what the gestational age is, as far as how long you can continue in the pregnancy. And it also depends on those Doppler studies. If they start to get worse over time, and then you have to look at the big picture, including all those variables I just mentioned, to see if the benefits of being delivered outweigh the risk of staying pregnant. So be sure to ask these questions. Why is my fetus growth restricted? If so, how severe, and do we have any idea why? Number 2, what does this mean for the remainder of my pregnancy? It typically means, I'll just tell you, that you're going to get weekly umbilical artery Doppler studies along with a growth scan every 3 to 4 weeks. You also need to ask about what we call antenatal fetal surveillance, and that typically includes weekly BPPs through a certain gestational age, followed by twice weekly NSTs. And then, depending on how things progress, when would be the best time for delivery? If maternal fetal medicine is available where you are, it is ideal that they be consulted and involved in your care if you have growth restriction, if the fetus has growth restriction. I hope this helps. I know it's a lot, but I get asked this question quite often. So if you have other questions that I can try to answer, just put them in the comments.